Hello and welcome to Pulse Check with Archer Nursing, where nursing comes to life. In this podcast, you give us 15 minutes of your day, and we'll take one complicated nursing topic and make it easy. Ready for nursing to be fun? I'm Morgan, and today we're tackling Graves' disease. As always, let's kick things off with our practice question. The nurse is performing discharge teaching for a client with Graves' disease. Which of the following client statements indicates effective understanding? A, I will take my pulse daily and report a rate less than 60 beats per minute. B, I'm going to add hot yoga to my exercise routine. C, I will increase the amount of fiber in my diet. Or D, I should tell my physician if my blood pressure's top number exceeds 140. All right, tuck what you think the right answer away is. For the end of the episode, we will circle back after we talk about Graves' disease. This is the most common cause of hyperthyroidism, a condition where the thyroid gland produces too much thyroid hormone. This is specifically T3 and T4. To really understand what's happening, you have to know what those thyroid hormones do to your body and how they're regulated. So let's go all the way back to the thyroid gland itself. It is a butterfly-shaped gland that sits at the base of your neck, and its job is to regulate metabolism, basically how fast or slow your body's cells use energy. Now, it is controlled by something called the HPT, the hypothalamic pituitary thyroid axis. Now, this is just a really finely tuned feedback loop where everything is dependent on each other. Here's how it works. Basically, the hypothalamus releases TRH, that's thyrotropin releasing hormone. And that tells the pituitary gland, hey, go ahead and release TSH, thyroid stimulating hormone. TSH then acts on the thyroid gland saying, you can go ahead now and release thyroid hormone, T3 and T4. Now, once those hormone levels rise high enough, they balance out and go back to the pituitary and the hypothalamus, telling them, hey, stop producing more. Honestly, you can kind of think of it like a thermostat. You know, we're rising the temperature, it gets high enough, and then it signals, okay, go ahead and shut off the heat, the room is warm enough. Now, in Graves' disease, that feedback loop is hijacked. All right, the immune system produces thyroid stimulating immunoglobulins, basically antibodies that are going to go and attack the thyroid. They latch on to the thyroid's TSH receptors and just tell it, make more, keep going, make more thyroid hormone. The thyroid itself cannot tell that signal isn't coming from the pituitary where it's supposed to, that it's these immunoglobulins. So it just keeps putting out T3 and T4, more and more thyroid hormone. It's a factory stuck in overdrive. So now what actually happens to the body with this excessive level of thyroid hormone? All right, thyroid hormone you can think of as like the gas in the car. They are energy. And cells are going to be burning through energy fast. Oxygen demand goes up. Every system is revving on high. Heart rate up, contractility up, cardiac output increases. Now, that can lead to a lot of strain on the heart and even tachyarrhythmias if left untreated. Now, on our other systems, that metabolic hyperactivity is ramping up our body's heat production. So clients with Graves' disease usually describe feeling really hot all the time, and they have heat intolerance. They can't deal with being in warm environments. In their nervous system, it's in overdrive. Tremors, anxiety, irritability, insomnia. This is all because that thyroid hormone, that gas in the car, too high, too much energy, everything is going up. Now, one of the hallmark signs that you are guaranteed to see on some sort of exam in your nursing life is called exophthalmos. These are bulging eyes, and they happen when those same autoimmune antibodies also stimulate inflammation and tissue expansion behind the eyes. Basically, that connective tissue swells, it pushes the eyes forward. That can cause dryness or vision changes. And unfortunately, it's not reversible. So if you see someone with that exophthalmos, you should really be thinking Graves' disease. They've got too much thyroid hormone. So let's go into our case study for the day and see what we can actually do about this overproduction of thyroid hormone. You are seeing a 32-year-old woman, we'll call her Laura. She has come in for evaluation of unexplained weight loss and anxiety. Here's the story she tells you. She has lost 15 pounds in the past 2 months. She's not trying to lose weight. She was a very healthy weight. And lately, she's been feeling, quote, like a hummingbird, like her heart is racing. Her hands are trembling even when she's sitting still. She's hot all the time. She's sweaty and anxious. And she's so hot, she's trying to sleep with the window open, but her husband is bundled under a blanket because she's keeping the house so cold. So, all of these things put together, if someone just comes in, they're like, I feel like a hummingbird. I have trembles. I've lost weight. Individually, that might not make a lot of sense. But when you put all those signs together, those are all things that happen when we have too much gas in the car, too much thyroid hormone, too much energy. Her metabolism is way too high. So let's move on. Let's do her assessment. We get her vitals. Her heart rate is 116. She is hypertensive. Her skin feels warm and slightly damp. And there is a visible tremor in her fingers when you are holding her hand and trying to take her pulse. Looking at her face, you can see a slight bulge in the eyes, that exophthalmos. So that is your telltale sign. Hey, this could be Graves' disease. All right. So what's your next move? We gotta get some labs. Labs are gonna help diagnose this problem. We wanna look at a thyroid panel, TSH, T3, and T4. What are we gonna see? You know that T3 and T4 are going to be high if we have Graves' disease, right? Because we got a lot of metabolism, a lot of energy, gas in the car. What about that TSH? Is that TSH gonna be high too? You might think so at first, but no. TSH will be low. It will be suppressed because the pituitary, it's trying to slow things down. It's suppressing that TSH. But remember, we've got those immunoglobulins that have latched onto the thyroid, making it think, hey, I need to make more T3, more T4, and just keep on going. So it's kind of funny how that works, where you see the thyroid hormone T3 and 4 get really, really high, but the TSH gets low. Okay. That's the two things you're looking for when you're diagnosing Graves' disease, hyperthyroidism. So what do we do about it? We got to slow this thyroid down somehow. All right. The first thing, medication. We're going to go from least to most invasive. Methimazole is an anti-thyroid medication that works by blocking thyroid hormone synthesis. So basically, without fancy words, we're cutting the power to that thyroid factory so it can't just keep flooding the body with these hormones. Now, if methimazole is not enough, if that doesn't really do the trick to get those thyroid levels down, we can go up to either iodine compounds or radioactive iodine therapy. And these are going to decrease the size and vascularity of the thyroid gland, really trying to destroy those thyroid cells so that they can't produce as much thyroid hormone. Last but not least, if none of those medical interventions work, we do have a surgical option where we can do either a partial or full thyroidectomy. So that's surgically removing either all or some of that thyroid gland, because if it's not there, it can't produce that hormone. Now, one other medication that you might see clients with hyperthyroidism placed on is propranolol. This is a non-selective beta blocker. It is not going to do anything to the thyroid gland. It is not going to change the production of thyroid hormone, but it will slow the heart down. It's going to help control the racing heartbeat, the tremors, the anxiety, basically kind of blunting the effects of all that extra thyroid hormone on the nervous system. So again, not treating the cause, buying time and keeping our heart safe while the medication kicks in. And remember, we're starting with that methimazole. So now time for some medication. What will you as the nurse teach this client as she goes home with this new diagnosis and this medication? First thing is regular lab monitoring is going to be real important. We got to keep those thyroid levels in check, and too much or too little medication can swing them a lot. So consistency and follow-up are critical. Now, for hyperthyroidism, we also want to avoid any stimulants like caffeine. Her body's already in overdrive, running hot, tremors, anxiety. We don't need any extra stimuli. And because she had that exophthalmos, we need to educate her on eye protection. We need some lubricating drops to keep them moist. She should be wearing sunglasses outdoors to prevent dryness and irritation. And we need to do careful education about the danger signs or the red flags of her condition getting worse. When hyperthyroidism gets worse, it can progress into what we call a thyroid storm. This is basically like all the symptoms we already talked about, but on steroids. We get a fever, severe tachycardia, tachyarrhythmias, confusion. All of these things are indicative of a thyroid storm. So we need to educate her to watch out for that and come into the clinic quickly if those signs present. Which brings us right back to our practice question. You've done the education. So now, as you perform discharge teaching, which of the following client statements would indicate effective understanding? Is it A, I'll take my pulse daily and report a rate less than 60? B, I'll add hot yoga to my exercise routine? C, I'll increase the fiber in my diet? Or D, I'll tell my physician if my blood pressure's top number exceeds 140. What do you think? If your client with Graves' disease said all four of those statements, which one would indicate effective understanding? Shout it out, jot it down. Hopefully you said D, telling the physician about a blood pressure over 140. That indicates understanding because with Graves' disease, we have that spike in thyroid hormone that's putting everything in overdrive. So things are speeding up. Tachycardia, hypertension, tremors, the metabolism is skyrocketing. Okay, so we want to look for the heart rate going too high, not too low. That's why A was wrong. The blood pressure going too high. That's why D was right. Now, B, adding hot yoga, or C, increasing fiber. Usually those sound like pretty good and healthy lifestyle choices. But B, hot yoga is a no-go because of the heat intolerance that comes with hyperthyroidism. And hot yoga would make that way worse. Those rooms are really hot. We don't want to do that. C, adding fiber, that helps with constipation. But oftentimes people with hyperthyroidism experience the opposite. They have increased bowel movements due to that revved up metabolism. So they're not dealing with that constipation. We don't need to move their bowels faster. Increasing fiber would not be a good recommendation. So all that to say, wrapping it up here, Graves' disease is like the body's metabolism stuck on high. The heart, the blood vessels, the nervous system are all working in overdrive. So as the nurse, recognize those signs, especially when blood pressure and heart rate start to go up, because in Graves' disease, keeping that body's engine from overheating is really where we need to focus. Right, future nurses, that is a wrap. If you found this pod helpful, I'd love to continue supporting your nursing journey through nursing school, the NCLEX, continuing ed, and beyond. Archer Nursing has you covered with on-demand video lectures, high-yield question banks, live case study reviews, and so much more. We want to help you master tough concepts and make it fun. So join us over at archerreview.com. Follow us on socials at Archer Nursing for more free nursing tips and study resources. Thanks for tuning in to Pulse Check with Archer Nursing. I'm Dr. Morgan Taylor, and I'll see you back next time.